Today we're going to be talking about some positions of relaxation for our low back and pelvis. These positions are sometimes referred to as McKenzie exercises or McKenzie positions. A couple things before we actually demonstrate some of the positions. The first most important thing about these positions is that we need to maintain complete relaxation in the low back muscles while we do this. We are not using those low back muscles to hold ourselves up in the positions. The whole point of these exercises is that the low back muscles are maintained in relaxation while we're moving into these positions. So that's one thing to consider while we're doing these exercises, consciously being aware of how our muscles in the low back are staying relaxed. A couple other things about these positions is that they're basically common sense kind of positions. If we are sitting or standing in a forward bent slump posture throughout the day, we're going to use the opposite of that, extended opened up positions, to help to relax and reset some of the low back muscles. Again, the main concern is that we're trying to relax some of those low back muscles that are either in spasm or are causing pain. So the first thing with these McKenzie postures or McKenzie positions is lateral bending or side bending. Lateral bending or side bending is exactly how it sounds. It's bending ourselves to the side. We're going to be showing you that on the table, face down. First position is face down, and like we had said in the introduction, the first thing we're going to be doing to relax some of these back muscles is side or laterally bending our hips. If I'm going to be side bending to the right, all we do is shift our hips off to the right. We relax and breathe into this position, and that is the first phase. It's always side or lateral bending. We bring our legs back to central. Next position is sometimes known as Sphinx position. It's when we bring our forearms up in front of us. We bear weight into our forearms. We stay long in our head and neck. We're not slouching or sagging. We press down through our forearms to raise up, and we maintain that extended position in our low back or lumbar spine. Again, key point to remember is that you are really holding yourself up by pressing down and using your upper body. Your low back muscles are maintained in relaxation. Now, with this Sphinx position, you can also do this with your hips shifted off to a particular side. Again, we can maintain this position, breathe in this position for minutes at a time. Bring the legs back to center. Next position is the fully extended position on our hands, where we press down with our upper body and our hands to raise up into full extension. Similar to Sphinx, we're using our upper body and arm muscles and chest muscles to raise up. We are not using our low back muscles. We're trying to keep those relaxed. Another thing in this position, similar to Sphinx, is that I'm not sagging into this position. I'm pressing down to stay long through my head and neck. If you can't maintain this without sagging, you just can't do it. You have to go back down to your forearms and rest here. In the Sphinx position, as well as the extended arm position, we can bring our hips to a side and come up into the fully extended position. Finally, last exercise is to literally be doing press-ups or push-ups into the extended arm position, up and down. Again, just to repeat, we're not using those back muscles. I'm using my upper body and chest to do this. Similar to the rest of the exercises, these press-ups can be done with our hips shifted off to the side, pressing up and down. So now we're going to be demonstrating some of those McKenzie extension positions or exercises from a standing position. The same rules apply. You are not going to be using any of those back muscles to move into these positions. These are passive movements where we are using our hands to physically push ourselves into these positions. Just like the laying down positions, the first thing we do is a side bending exercise where we take our hand, put it into our hip or pelvis, and we physically push our pelvis to the side. Look something like this. And you can do reps of this or hold and stretch into that position. Again, I am not actively bending to the side. I'm doing nothing with my upper body and physically pushing myself to the side. This exercise of side bending can also be done leaning into or against a wall. So if I put my forearm and lean into a wall and then just allow my hips and pelvis to sag into the wall, that is another way to do side bending. Lastly, we can do that bent back or extended position standing up. We take our hands or our fists, we place them into our low back, and we physically push our pelvis forward. Again, this is a passive movement. I am not actively bending backwards with my back muscles. My back muscles are doing nothing, and I am physically pushing forward like this. So throughout the day, you can stand up from your desk or your chair. We can do side bending, and we can do passive extension standing. So one of the main caveats when doing these exercises is that we want to feel or see something called centralization of pain or symptoms. Centralization of pain and symptoms basically means that if you're sitting down at your desk for a long period of time and you start to feel some aching in the back of your leg or your buttocks, when you do these exercises, I want to see the pain centralize or move back up towards your low back. So again, if you're aching in the back of your thigh or your butt, and you do the exercises and now you start to feel the pain into your low back, that's normal. We want that, we expect that. The one thing we do not want to see in any of these exercise positions is something called radiation of pain. The example would be if you've been working all day and your low back is really stiff and sore. You go to do these exercise positions and now your low back isn't sore, but your buttocks or your thighs are starting to ache and feel pain. That is an example of radiation. We do not want to see that. If we do start to experience radiation of symptoms, just simply lie face down, go to one of the lower positions, relax and breathe, and allow that pain to subside or centralize. So again, we want to see centralization of symptoms or just simply elimination of symptoms. We never want to see radiation of symptoms. Something to keep in mind when we do these exercises.